Hello, everybody. This is Al from Cornell's Dairy Extension, bringing you back our coronavirus updates. This is the update for the week of November 22nd. First of all, the updates on our national coronavirus trends, which are not very promising. The record high numbers we reported on last week have increased even further this week. For example, yesterday, almost 84,000 people had to be hospitalized, which is an all-time high for a single day. Since the numbers of new cases and hospitalizations has been going up for quite some time, the number of deaths needed to follow at one point. The 7-day average on daily deaths is now almost 1,500, which is 28% increase from last week. If we look at the numbers specifically for New York State, although the numbers are kept relatively stable overall, there are regions where the positivity rates are going up. And there are also specific counties where the positivity rates are 6% or even higher. My advice to any processor is to keep an eye on those numbers in their specific region, county, town, just so you make sure you can react on time with any enhanced control strategies. When it comes to basic control strategies, like keeping that social distance of 6 feet, correctly wearing that face covering at all times, and washing your hands is actually what's going to get us out of this crisis. It is on all of us to follow these strategies, and it's very important to follow these strategies both outside and inside of the work environment. This last part on minimizing the community spread is relevant now more than ever, just because we are entering this holiday season together with the second wave of pandemic. So people that are planning to get together for Thanksgiving celebration with their friends and family, I have a perfect advice on how to protect yourself and loved ones from COVID-19. And the advice would be just don't do it. As CDC says, it's best to stay home and celebrate with people you live with. And what you can do is connect with your friends and family on Zoom or a similar platform. Now, if you still decide to get together with your friends and family, this is the advice that our group from Cornell can give you. First of all, people can quarantine before getting together. For example, a 5-day quarantine would identify and break the chain of transmission for half of the symptomatic infections. People can also get tested if testing is available, and that would also address the asymptomatic carriers. I know that neither of these two are perfect, but they're definitely powerful steps in reducing the risk. Next, before you start the event, make sure all people that are attending the event are without any symptoms. What you can also do is actually measure the body temperature at the event just to make sure people don't have fever. At the event, be strict about keeping that physical distance at all times, wearing appropriate face coverings at all times, and washing hands regularly. What I would add is when wearing face covering is not possible, for example, when you're eating, make sure you're not speaking, just to minimize the generation of those respiratory droplets which are associated with transmission of the virus. You should also avoid touching your face, like nose, mouth, and eyes. And you should not share your food, your drinks, plates, utensils. What's recommended is that if you are getting together with people, to get together outdoor instead of indoor. Outside, we are less limited by space. The respiratory droplets and the virus has harder time traveling from one person to another. Also, when we are outside, we also don't have a problem with these respiratory droplets and virus accumulating in the air, which can be a problem when you are getting together indoor. So when you are getting together indoor, make sure the indoor space is not overcrowded. People should be able to keep that 6 feet distance. Also make sure that the indoor space is not occupied for too long. And the indoor space should have proper ventilation. Now, if you don't have a mechanical ventilation, make sure you open that window just so you support sufficient exchange of air. It is very important to establish the rules before the event, and you inform all the people of these preventive measures on time so everybody knows, what to expect and follow the rules on time. For example, it's very hard to talk about preventive strategies when your uncle is already hugging you at the doorstep without wearing a proper face covering. Another thing I would like to emphasize is that the food safety is just as important now as it was before COVID-19. So what we recommend is to follow the USDA guidelines on how to stay food safe. Some of the things to emphasize, of course, hand washing, very important. It's also very important to wash and sanitize your surfaces and appliances, especially when you're switching from raw to cooked and ready-to-eat foods. When it comes to produce, rinsing your produce with cold running water is sufficient. Do not use any detergents, any sanitizers, or other chemicals to wash your food or packaging. Keep raw food separated from the cooked and ready-to-eat foods, and make sure you're not cross-contaminating the food. Lastly, use a food thermometer just so you can make sure that you are cooking that food to appropriate temperature and you are holding that food at appropriate temperature. So with this, I would finish this coronavirus update and ask you to watch over each other and stay safe. Thank you.